Okay, so today's video is on what to expect after ear tube placement. So most of the time I'm placing ear tubes, it's in young children. And usually the reason is for recurrent ear infections or chronic fluid behind the eardrum. So for young children, we do this procedure with them asleep under anesthesia. Um, so typically the day of the surgery, your child will probably be kind of groggy and not their usual self for the rest of the day. But usually by the next day, they're mostly back to normal again. Fortunately, ear tube placement is not a real painful procedure. There may be a little bit of discomfort in the ears afterwards, but it's usually nothing terrible. So usually I just recommend Tylenol or Motrin or whatever you typically give for aches and pains for your child. The thing we normally notice after ear tube placement would be drainage coming out of the ears. And this is totally expected. The reason the tubes are put in is because there's fluid back behind the eardrum that's trapped. So I do clean all of that fluid out during the procedure, but sometimes if it's infected and it's inflamed, the ears may drain out through the tubes for a day or even a few days afterwards. So you may notice yellow drainage coming out. There's sometimes even bleeding coming out of the ears afterwards. And that's all totally fine and expected. So I will give you at the day of the surgery a little bottle of ear drops to use that you'll put into your child's ears normally for about 3 days after the surgery. But sometimes I'll instruct you to use it longer depending on what things look like in the ears. Other things to be aware of. It's not unusual that your child may have a fever off and on for 48 to 72 hours after the ear tubes are placed. And the reason for this is really just a reaction of the body to having anesthesia and having surgery and basically getting messed with. Your body or your child's body will a lot of times produce a fever just in response to sort of all the stress of having surgery. You can give Tylenol or ibuprofen to treat the fever, and usually it goes away within 2 to 3 days. If it's lasting longer than that, you can certainly contact me to find out further information. So that's really it in terms of ear tubes for children. For adults, we put the tubes in the office, so there's not the problems with anesthesia, fortunately. But again, adults may also see drainage and bleeding from the ears after the procedure temporarily. So that's a general idea of what to expect after ear tube placement. And you can certainly give me a call if you have further questions or if you're one of my patients. We'll talk to you soon.